Hello, I'm Betsy Ross, and welcome to Healthline. Getting a good night's sleep is so essential to maintaining good health, so we've invited Dr. Roy Mosier to help us understand sleep disorders. Joy Ernst will take us inside a sleep study, and Nick Yelton will show us how to use a sleep mask. We're pleased to announce that today's program is being sponsored by Remke Medical. It's all next and more on Healthline, presented by the Northern Kentucky Medical Society. We all know that sleep is a necessary part of our lives, but how well we sleep can directly affect our health and the quality of our daily living. Our first guest today is going to help us understand sleep disorders and how to determine if we just might have a problem. Dr. Roy Mosier is the medical director of the St. Elizabeth Sleep Disorders Center. Doctor, thank you for joining us today.
My pleasure.
We all hear about getting a good night's sleep, but why is it so important for us to get that good night's sleep?
Now, not getting good sleep has a greater impact than simply feeling tired, drowsy during the day, not being able to focus, not being able to concentrate, irritability, things we've all felt. It can have an effect on your health, too. We know that people who don't get good sleep, their immune system is suppressed, and so they're more likely to get sick, get a cold. People who work shift work are more likely to have irritable bowel syndrome or ulcers. Breathing problems during sleep, like sleep apnea, can bring on a heart attack or a stroke sooner than would have otherwise have occurred, or wear your heart out and even kill you prematurely in severe cases. So there are a lot of things that can impact. People with attention deficit disorder may well be due to a sleep disturbance, because not getting enough sleep makes it harder to focus, makes you irritable, makes you hyper, and particularly in children. And so the symptoms overlap.
And you talked a little bit about the types of sleep disorders, but go into a little more detail on what kinds of sleep disorders are there.
Well, the most frequent is insomnia, which to us is difficulty either getting asleep or staying asleep, and that can be for a lot of different reasons, not just stress. Sleep habits, medicines, medical illness, things. Obstructive sleep apnea is a breathing problem during sleep, where you stop breathing as many as 100 times an hour, and that obviously has an effect not just on sleep, but on your health by lowering your oxygen level. Restless legs occurs when you're awake, where you have an irresistible urge to move. Periodic limb movements during sleep, where your legs twitch. And narcolepsy is an inherited disorder that's less common, that makes you very sleepy.
Of course, we all have nights that we can't get to sleep, and usually it's not a problem. It'll happen once every few weeks or so. But when do we make the decision that maybe it's something serious, maybe we should go to a doctor?
No, either if it's more frequent than, of course, every few weeks sounds pretty often, but if it's affecting the quality of your life or your relationships, your work productivity, but also if you have other issues going on where it'd be more important to know, i.e. you have a high-risk job where being sleepy could be dangerous. People with, as I said, if you've had a heart attack or a stroke, then knowing about your breathing at night is much more important. People with dementia or attention deficit disorder, it's more important to look. So I would suggest if you're concerned or if there's any question, talk to your family doctor, because they'll know how to take care of more common issues to take care of it for you, or when it's appropriate to go to a sleep center.
So if the doctor, our primary physician, says, okay, it's time to go to a sleep center. So we go there. What will they look at? What will they try to find to see what the problems are with sleeping?
Well, most people who are bad enough, I guess, to make it to a sleep center either have a very bad version of one or two diseases, but quite often it's a combination of things. It's not simply going to get a test where a test number is sent back to your family doctor. It's a whole evaluation process that, if to do it right, to figure out what's going on and to tailor the treatment to the individual person, you have to know not just about their sleep-wake patterns, what happens when you're awake or when you're sleeping, but your general medical history, your old medical records, your health, physical exam, lab work, and all that has to be combined with your sleep study to make sense out of what's going on for the individual.
Now, later on in the show, we're going to be going to a sleep center and taking a look at exactly what goes on, but just tell us in general some of the sleep studies that go on there at a sleep center.
Well, polysomnogram is just a polygraph, multiple channels of testing something during sleep, and there aren't any needles. It doesn't hurt.
That's good.
It's the same thing as an electrocardiogram. They use tape and paste to hook on things. So we're just measuring. We measure brain waves, eye movements, and muscle tone to see if you're awake or asleep, what stage of sleep you're in. We measure your breathing in terms of airflow, whether you're trying to breathe or not with effort. your oxygen level, pay attention to your heart to see how it's affecting that. So all that has to be tied together to, again, make sense about what's going on and how important it is.
So you get all this information, put it all together. What are some of the treatments that someone can go through to help them sleep better?
Well, obviously, it depends on the problem.
Right.
And that's why it's important to define all the different problems that are going on. With sleep apnea, there are a variety of treatments. Nasal CPAP stands for continuous positive air pressure. It's a mask that blows continuous air through your nose. BiPAP just stands for bi-level, a little bit more sophisticated version of the same thing. That if it fits correctly, should not be uncomfortable. And for moderate to severe apnea, it can be a wonderful treatment to get rid of apnea, but it's not for everybody. There are a variety of surgeries that can work quite well, either alone or in combination with weight loss and other things to get rid of the apnea. There is a mouthpiece to pull your lower jaw forward that can work also for some people. So matching all that together to the individual person is the trick.
Anyone who watches television has seen all the ads for sleeping aids, prescribed sleeping aids,
Right.
even over-the-counter sleeping aids. Are they really effective?
Some can. The Breathe Right type nasal strips that reduce resistance through the nose can help with snoring and maybe very mild apnea. The sprays are probably just lubricants to reduce the noise of the vibration. But again, for some people, those things can be helpful.
All right. Doctor, I guess the big thing that we take from this is make sure somehow we get enough sleep every night.
That's a good idea.
Doctor, thank you so much for being with us today. We'll be right back with more right after this.
We all take different paths in life. At Central Bank, we understand this. With a comprehensive selection of financial services and expert advice to meet all your needs, Central Bank is there to guide you down your path in life, wherever it may take you. Central Bank, showing you the way.
Well, as we just heard in our last segment, sometimes a on-again, off-again sleep problem can become a sleep disorder. When that happens, you might need to go seek professional help. We're here to talk about really what can happen when you need a little help trying to figure out your sleep issues is Joy Ernst. She is the Director of Operations at the St. Elizabeth Sleep Disorders Center. Joy, thank you for being with us. Brand new facility. You've been around for a while, but this itself is a new facility.
Correct. We've been open since 1988. We were located at the North Unit in Covington, and we just recently moved out here to the South Unit, brand new, top-of-the-line sleep disorder center.
And it has to be really cutting edge what you can do out here at this facility.
Yes, it is. It's beautiful, and we can do just about everything here.
All right. Well, while we get ready to talk a little bit more about what the patients will experience here, first let's kind of take a little bit of a walking tour of your facility. So a patient will come here after being referred by his or her primary physician, and the first stop that the patient makes is the consultation room.
Yes. The patient will see one of our sleep specialists, and he will take some history, do a little bit of a physical, and then at that time he will recommend a sleep study, overnight sleep study if needed.
So if the doctor recommends that there should be an overnight sleep study, how long is it between the time that you come in here for your initial consultation and the time that you'll come back for a sleep study?
About 5 to 7 days. We can get you in. We are open Sunday through Friday for overnight sleep studies. And if someone happens to work third shift, we can even bring them in during the day and run them.
So you keep them on whatever their natural
Absolutely, yes.
sleep shift is?
Yes. Yes, we want to keep it as close to their normal schedule at home as we possibly can.
So here we have a patient who is getting ready for her overnight stay. Tell us what's going on here.
Right now, Duana's placing electrodes on the patient. We're going to monitor the patient's EEG because that's how we can tell when the patient is sleeping. We're going to put some electrodes on her chest to monitor her heart rate, and then a couple on her legs to monitor her legs jerking or movement of her legs. Then after all this is in place, we will take the patient and place them in their room.
Now, what will a doctor look at? What kind of information are we getting here? You talked about the oxygen and the leg movements. What does that have to do with sleep?
Well, a lot of times when people go to sleep, they will quit breathing, or they will have a 50% decrease in the breath, and that's everything that these wires are going to pick up, and that will determine whether or not the patient has apnea, and then that'll help him in his diagnosis and his recommendation for treatment.
So once all the electrodes are hooked up, as we said, now they go into the bedroom, and I tell you what, this does not look like a hospital room. This is an awesome bedroom here.
Yes, it is. We try to make it look just like home. And we have the ceiling fan, the private bathroom, television. We even have the Sleep Select mattress where the patient can, determine whether they want a firm mattress or a soft mattress, and it's completely up to them.
Well, this is a beautiful facility here.
Thank
So the patient comes here, and those electrodes that we just saw hooked up,
Yes.
This is where you get your data.
Yes. Yes, the patient, all those electrodes are connected to a central jack box, which plugs into the main power source there. And then we also monitor the oxygen level, and that's the gray cord, and that'll plug in also from the patient.
And you will be monitoring that for, we hope, 6-7 hours?
7 hours, yes.
Okay. Now, there are a couple of machines here that aren't connected to any of those. Tell me what these do.
If a patient is diagnosed with sleep apnea, then they come back for a second night with us. And then one of the methods of treatment is the sleep mask, and that's what that is.
And a sleep mask will do what?
That will open up the patient's airway, letting them breathe in and out, and then keep their oxygen level up, keep their heart rate where it should be, and just help them get a good night's sleep.
So once they have spent, as you said, you hope 7 hours here, you got a lot of data. You got a lot of stuff to go through.
Right. And each 7-hour recording is broke down to 30 seconds, and the technician will look at each 30 seconds and then make a report and hand it to the sleep physician.
And it's not just what you get off these electrodes, but there's also a camera too.
Yes. We are also monitoring the patient at night for position, because sleep apnea can be worse in certain positions.
So now you have all this data. The next place you go to watch it is the control room.
Yes.
So you have all your data, and it goes into the control room. And this really, it looks like mission control. This is where everything is monitored then.
Correct. The patient is up on the screen, and the technician will sit in here for the entire 7 hours and watch him scroll across the screen. And then in the day, the technician will come in and analyze it. And we'll get a report and hand it to the sleep physician, and he'll make the diagnosis.
What are we looking at here if we're looking at breathing problems?
Well, right here we have a patient who took 3 normal breaths, and then they went into a period of no breathing, which is what we call apnea. And then they took the breath, which right here you can also see the arousal, and this is what disturbs the sleep and makes the patient sleepy during the day. Now, some patients can do this to over 100 times an hour. I think our world record is maybe 130, 135 times an hour. And it causes them to be extremely sleepy during the day.
And they don't even realize that they're
No.
waking up or not even breathing.
No, not at all. And snoring doesn't bother the patient. It bothers the spouse or the bed partner. But no, the patient doesn't even realize they're doing this most of the time.
So you've collected all this data. You have the video. You have the charts. Then what happens?
The data is given to the sleep physician. He analyzes it and makes a diagnosis. If the patient does have sleep apnea, then they come back in for a second night, a second sleep study, and they may wear the sleep mask, or the patient might opt for surgery if the anatomy is correct for surgery, or they could just choose to have do weight loss. And then for this particular patient, she woke up 145 times an hour, with sleep apnea. So she's probably looking forward to wearing a sleep mask and getting a good night's sleep.
I'm sure she is. Well, Joy, thank you so much. Congratulations to you, your staff, and St. E's. This is a beautiful facility with state-of-the-art equipment. I'm sure a lot of people will be getting better night's sleep once they come here.
Well, thank you for coming.
Thank you so much. And we talked a little bit about sleep masks, what they do. Well, coming up next, we're going to look at the different types of sleep masks and exactly how they can help you perhaps get a better night's sleep. That's when we come back. Stay with us. after a patient's been diagnosed with a sleep disorder, many times the doctor prescribes a sleep mask to improve the quality of their sleep. Our next guest is Nick Yelton. He's a respiratory therapist from Remke Medical, the sponsor of our program this month. Nick, thank you for being with us.
My pleasure, Betsy.
By the time a customer comes to you, has that person already been to a doctor?
Yes, ma'am. The patient would be probably referred to from their family physician to the sleep lab.
So what are some of the steps once that person comes in? How do you start talking with them? How do you get the information that you need to really figure out what you need to do as a therapist?
Well, most of the time the sleep lab has already ran the test and either faxed it over to us or sent us the order to set the person up either on CPAP or BiPAP. And more times out of none, they basically tell what size mask or what type of mask the patient. But we give the patient the option of 3 or 4 different masks. Number one is comfort. If the patient's not comfortable, they're not going to wear the machine.
Let's take a look at some of the video that we have as you work with a patient to try to figure out exactly what that person needs to really get that good night's sleep.
Now, this particular patient came into our store, and basically we go over the paperwork with her, insurance verification, and make sure everything is up and ready with that. Then in turn we show her the mask that was ordered for her. Also, if that's not the one that she's comfortable with, I'll show her a variety of other different masks. Show her basically how it fits on the glass head there to see how it's going to go up into her nose.
And you make sure that you fit it so that it is comfortable.
Absolutely. Absolutely.
And how do you make sure that it's comfortable? We see you doing some adjustments.
Adjusting there's like the straps, and some people, you almost have to get them real tight in order the mask to stay up in there. So basically, you want to make sure that it's fitting right up into their nostrils. That's the machine itself. This particular patient was on CPAP. There's an on-off button there in the middle, and then the other button to the left would be a delay or ramp. CPAP is continuous positive airway pressure, so what you do, that starts it out at a lower pressure, increases 30 minutes into their sleep, lets the patient get to sleep. And the other thing on the left is a humidifier. Most patients complain of dryness, scratchy throat, so we have a humidifier on the left side of the machine, and we dial the temperature up 1 through 5 to basically give them moisture while they sleep.
Now, is this a trial and error, or when you get the paperwork from the doctor, does that give you kind of parameters of how you're going to set this?
Yes, it's more of a trial or error, but basically it's going to take the patient at least 3 weeks to a month before they can actually tell a difference. There's the humidifier itself. We put distilled water in there. We show the patient how to clean all the equipment at the end of the setup. Setup takes about 20 to 25 minutes. There we are adjusting the mask, making sure it's fit tight and snug. Basically, you don't want leaks. If you got leaks, you're basically, the machine's not going to do its job. So we tighten all the straps. We want and have the patient. I make sure that the patient puts it on also before she leaves the store. We either go into the home, or basically we like to get them into the office, because that way we can show them a variety of different things that we can offer for them.
And you show the patient how the hookup is
Yes,
set.
absolutely.
Everything that is set, you show
Right.
them how to do that
Absolutely.
themselves.
And comfort. Once again, there's the different variety of masks. That's the one that she used. There's a one that has 2 straps. It goes completely over the nose and the top of the lip, and there's another one. There's about 10 or 15 different styles of masks.
And it's for comfort and for what the patient needs?
Absolutely. Absolutely. Correct.
Well, when you talk to patients, even though it is, as you said, trial and error, and it takes about 3 weeks, 4 weeks to really get this going, what do you hear from patients once they get into this therapy?
It's amazing the reaction that you get. We have about an 85% success rate. It does work. People call me up, or most of all, their spouses will call me up and say, this is the best thing that ever happened. you know, and it does work. They have more energy, you know, they're not tired all the time, and they just have a lot more pep.
And our model that we were using there, Laura, she had some great words to say about this.
Absolutely. She was wonderful.
Let's take a look at some of the things that she said about it.
I had sleep problems. In fact, I took 2 days off of work because I just couldn't get enough sleep. So I finally went to the doctor to see if they could help me. The sleep study test I had was in 2 parts. The first part I had to go and just sleep at the clinic for them to monitor me. They hook you up with wires, not too bad, and they just let you sleep all night. And then the second test I had to come in, hook up with the same wires, but they let me try one of the masks to get the regulation of air pressure correct. After the doctor had a chance to review the results of my test, they said I woke up 37 times an hour, and that's why I wasn't getting good rest. That's why I was tired all the time. The doctor suggested that I try a CPAP machine, that can regulate your airflow and it'll keep you from waking up so many times so you could actually get a good night's rest. I've been using the sleep mask for about a month and a half now. It really makes a huge difference to use the mask. I wake up, I've got energy, I haven't missed a day's work since. It really has made a huge difference for me.
And to have somebody have that big of a difference now that they can sleep, it has to make you feel awfully better.
Absolutely. It's wonderful. I mean, to hear the people reaction they get, the testimonies are just amazing.
Nick, thank you so much for being with us.
My
great
pleasure.
information, important information. We appreciate it. Thank you so much.
Thank you.
After this break, we have local doctors answering your medical questions and our house calls segment. Stay with us.
We all take different paths in life. At Central Bank, we understand this. With a comprehensive selection of financial services and expert advice, we'll help you meet all your needs. Whether you're getting your first home, preparing for a growing family, or planning for your children's futures, Central Bank is always there for you. Central Bank, showing you the way.
Welcome back. Our House Calls segment gives you, the viewer, an opportunity to ask questions about your medical concerns. And we have doctors from the Northern Kentucky Medical Society ready to answer your questions. Our first question comes from Sally in Taylor Mill. My husband and I are both weekend warriors, and we love to be active with sports. What can we do to prevent sports injuries? Well, we asked Dr. John Larkin to answer this question.
Sally, I think that the most important thing, especially as we get older and participate in sports, and the good news is everyone is more active now. I see patients all the time that are active in sports in their 70s and 80s, and that's what you want to encourage. However, the most important aspect of prevention of injuries as you get older and as you participate in sports as you get older is stretching. It represents probably the fundamental thing that you need to do in terms of a warm-up. Whether it's tennis, running, racquetball, or even swimming, you need a 15 to 20 minute period of warm-up and stretching prior to exercise program.
Dr. Marianne Barnes answers this question from Louise in Alexandria. I've been hearing so much about this new HPV vaccine for cervical cancer, but I'm confused about the latest news. Should I have my 14-year-old vaccinated? And do insurance companies cover this proactive treatment?
That's a great question. Recently, we found out that the HPV vaccine is not going to do what we originally hoped it would do. Based on studies from the early 1990s, we thought that types 6, 11, 16, and 18 were the most common. However, last week it came out that there are other types that are much more common. The insurance companies are paying for it, not Medicaid, however. I would still recommend it for your daughter, as that these types are still out there, but probably there'll be new vaccines coming out soon.
And our final question is from Mary Ann in Villa Hills. I'm 58, and during this past year I have been having increasing difficulty and discomfort with my left shoulder. My ability to raise my arm is becoming severely restricted and certain movements are painful. What could be wrong? Someone told me I had a frozen shoulder. What does that mean and what can I do to correct this problem? We went to Dr. Samar Hassan for this answer.
Well, Marianne, you may have a frozen shoulder. It's actually a very common condition in women between the ages of 40 and 60. We also see it in patients with medical conditions like diabetes, for example. We're not sure why it happens, but what happens is that the lining that envelops the ball and socket joint, or the shoulder joint, gets really thick and stiff. And it also gets very inflamed, which is why patients experience pain. Patients typically have trouble reaching overhead or behind their back, for example, to put on a coat or fasten a bra. The good news is that it generally gets better. It responds to simple measures, for example, physical therapy and exercise. Anti-inflammatories can also be helpful to alleviate some of the pain. We also might consider a cortisone injection into the joint for that same purpose. When that fails, and it does fail on occasion, we can consider a manipulation under anesthesia, in which the scar tissue is gently broken by careful manipulations of the arm with very gentle pressure. And sometimes we also do an arthroscopy, in which we make small incisions and take a look inside the joint, and then under direct visualization break some of the scar tissue. The good news is it almost always gets better.
Thank you, and our thanks to Dr. John Larkin, Dr. Marianne Barnes, and Dr. Samar Hassan for their professional medical advice. Oh, we've come to the end of this month's show, so we would like to thank our guests, Dr. Roy Mosier, Joy Ernst, and Nick Yelton. And a very special thank you to Remke Medical for their participation in this edition of Healthline. Now, if you missed some of the information listed on today's program, if you have a question that you'd like answered in our House Call segment, well, be sure to go to the Northern Kentucky Medical Society's website. Then click on the Healthline button. All of our program information is listed there, and you can email your questions as well. Each of our Healthline programs will air numerous times each month, so make sure you check the listings for the days and the times. We hope you'll join us again next month for a new program when we learn about what causes strokes, and we get a look at a cutting-edge rehabilitation therapy right here in Northern Kentucky. So goodbye for now. I'm Betsy Ross, and this has been Healthline, presented by the Northern Kentucky Medical Society.
Would you like to double, triple, or even quadruple your income and eliminate your credit card debt?
I make $5,000 a month in residual income.
These people got started by getting a free DVD that showed them the way to financial freedom.
We'll be making over $8,000 a month this month.
We made over $18,000 last month.
Our free DVD will guide you into the perfect home-based business.
Respond now while this is still a free service. Go to 77getmoney.com. That's 77getmoney.com.
Hi, I'm Nancy James, and if you haven't seen Northern Kentucky Magazine on ICN6, here's what you've been missing. New York Times best-selling authors, chefs creating their magic in our kitchen, music of every type performed by the Tri-State's finest musicians, local celebrities, and friends from your community with important news to share. The only thing missing is you. So join us every weekday at 10:30 a.m. for an hour of fun on Northern Kentucky Magazine on ICN6.